The necessary armamentarium for taking impressions involves trays, either disposable and or rimlock, regular set, or quick set, which is most commonly used for diagnostics, while the regular set is more commonly used for immediate denture impressions when you require a more accurate model. Mixing bowl, spatula, use the white one. We use adhesives for the disposable trays, that way the alginate impression remains in the tray. However, spray outside or the dispensing ladies will not be very happy with you. Rope wax. After making sure you have all the necessary armamentarium, seat your patient. Bring them to an elevated position, up to around the area of your elbow. Place the patient bib. It is important to note whether your patient is wearing eyewear or not. Because if they're not wearing glasses, then we need to get them some nifty safety goggles. Make sure to look inside the patient's mouth, check for sores, anything that might make them uncomfortable, and get a gauge of what size tray you think they may need. Make sure to rotate the tray in, pull the cheek aside, and go from back to front. It's important to note that when taking the mandibular impression, ergonomically, it's easiest to be in front of the patient. That way you can easily retract the lips and apply constant light pressure. And make sure that you can obtain all the necessary anatomy, including the tuberosities, hamular notch, and all the surrounding vestibules. Make sure the patient's lip can gently rest over the front of the tray, that way you can properly capture the buccal vestibule. Also, ergonomically, you'll find that it's easiest to stand behind the patient while doing the maxillary impression. Not only will you be able to have a better idea of the midline of the impression tray, you'll prevent them from throwing up all over, for instance, the gagger. Gonna go ahead and set this in for you, like so. Nice and jelly. Oh, it's okay, let it all out,
Complaints you might have when taking impressions on difficult patients, such as gaggers. Dr. Godoy and...
Always make the mandibular impression first.
Okay.
And have a bucket close by just in case.
Now, when you feel like the material starts to flow back down your throat, gently lean forward while I hold the tray in the patient's mouth. Also, breathe through your nose.
Okay.
In addition, concentrate on lifting up your legs. Pretend like we have here a topical gel that has a little bit of anesthetic in it. This will stop the feeling of the alginate from running down the back of your throat. Gently swab on the posterior portion of the patient's hard palate.
I can feel that working already. Any way I could take one of those home with me?
Here's how you'll know if your patient is more prone to pain.
Okay, I'm such an easy patient, don't worry.
Okay, great, thank you.
Ow.
Ow. Now, realistically, you'd love to do this to the patient. But here at Nova Dental, we abide by the code of ethics and honor our patients with non-maleficence. A good thing to use is rope wax. It's soft and will be a lot easier on the movable tissues. Some of the more painful areas are right here, right up in the posterior buccal vestibule. So I like to go right around so that the first layer is on the tray and the second layer adds height. Go ahead and mold it on the posterior border of the tray. In addition to alleviating pain for the patient, this also allows you to customize the tray by being able to tilt this area up to allow for better adaptation around the vestibules.
Questions. If you're taking impressions on patients and the rimlock trays don't fit,
I recommend students to switch to a plastic tray, and you can actually use the heat to form and to make some parts of the tray a little bit wider and modify the tray according to the patient.
and place the material into the tray. And when you put the material in the tray, you want to make sure not to overload it. And then I also like to take a little bit of material and place it onto the patient's mouth. Go ahead and lean your head back. Good. And open. Relax your lips. Good. And you'll want to paint the material on the facial and occlusal surfaces. And then when you're placing the impression into the patient's mouth, you'll want to guide the impression into the patient's mouth. Go from the back to the front. Make sure that you're getting their vestibules all the way around. Relax your lips. Good. And you'll want to make sure to do some border molding. Relax your lip. So you can tell the impression's set by the color change. It's now white. But some of the materials don't change color, so you'll also want to check with your finger. When you go to remove the impression, you want to get it all out in one swift motion. You don't want to rock back or forth. So what you can do is have the patient say ah, and at the same time pull out of the impression. Say ah, all in one swing.
Another way to help remove the tray is by blowing air up into the vestibule. If you notice the hard palate space here, it's full, it's well contoured, and there's no voids. Whereas in here, you have large voids like so, which for instance, if replicating for an interim denture or any other sort of removable prostheses, would cause the prostheses to dislodge. What you want to make sure to have is proper vestibule all around. Because in here you want to make sure that none of the tray is showing through, especially in the area of the maxillary incisors.
George, we just wanted to ask you a quick question. What your best advice is for a patient that gags a lot when you take impressions or constantly complains of pain?
Refer it out. Refer it out. Refer it out.